Cancer screenings for women.
Joining us live, as she does every Friday, is Dr. Jacqueline Pakel from the Medical College of Wisconsin. Let's start by talking about what these new guidelines are before we get into what cervical cancer is and all that.
So the guidelines state that anybody under 21 should not have a pap smear at all. We used to start at 18. We don't start until 21 now. Between 21 and 30, every 3 years. Between 31 and 65, every 3 to 5 years, and then beyond that, not having them at all.
Is there any controversy with this? Because cervical cancer doesn't present with a lot of symptoms, and when it is found, it can be advanced stage, and this pap smear is the only way to detect it, really.
That's right, and I do think that this is controversial. I know that there are different guidelines depending upon the organization that you look at, and I myself don't know that the guidelines are appropriate as of yet. I think time will tell. So
let's go back to cervical cancer. What is it, and how does it start?
So cervical cancer is cancer of the cervix, which is the bottom portion of the uterus. And we detect it through pap smears, and it starts through the transmission of the human papillomavirus, which is a sexually transmitted infection.
So by the time it's detectable, I mean, what's the development phase of cervical cancer?
So when you detect it, from the time that you actually get the virus itself to cancer, it's usually about a 10-year period of time unless you have a compromised immune system. So, and most of the time, 85% of the time, the virus will be eliminated on its own. Your body will take care of it.
So when it comes to the guidelines, it's a guideline, so not all doctors have to adopt this and recommend this for their patients, correct?
Yeah, one thing that we're seeing is that the insurance companies are certainly looking at this, and they want us to follow the guidelines because it's less expensive.
That's the tricky part.
Yeah, but there are high-risk populations that need to be screened more often. If you've had a moderate or severe dysplasia previously, you need to have further testing. If you have immune compromise like HIV, you certainly need screening more often as well.
And the prevention of cervical cancer is something we've been talking a lot about the past couple of years as this HPV vaccine has been so prominent. Fill us in on that.
Right. So the HPV vaccine, some countries actually are looking at that as a controversy as well. We only have about a third of our population that's actually vaccinated, the appropriate age group. We need to do better at that, but it's very effective.
So you're saying as far as the guidelines go, we need more time to really determine if they will be effective?
I think for right now, at least have the screening as often as they say, if not more often.
And talk to your doctor, because your doctor will probably always know best.
Yes.
All right,
yes,
Dr.
speak
Pakel,
with your doctor, yeah.
Thanks so much. Got a question for the experts? Email them. Ask the expert at tmj4.com. You can also leave a voice